Hi, my name's Greg Bradford, and I'm here today to explain to you Paul Ryan's Medicare plan. It's a pretty good plan, and when I get done explaining it to you, you're going to see that it could put money in your pocket. Okay, so it's a pretty good plan. So here we go. Let's start seeing what's going on with this plan. Okay, first of all, I need to ask you, are you 55 years of age? Okay? If the answer to that is yes, then guess what? You have no change in your Medicare. Absolutely no change. None. You're the same. You're the same from here on out. You're good to go. Don't worry about it. What if you're on the no side of that question? Okay, well, that's where things start to change a little bit. Okay, but there's some good changes in there. Once again, I think you'll like them. Okay, so if you're on the no side, I'm going to reuse this box right here. If you're on the no side, the question becomes, do you like Medicare as it stands today? Do you like it exactly as it is? If the answer to that is yes, then guess what? No change. No change at all. You're still good to go. Okay? 55 or under, and you like Medicare, no change for you. You can opt in. You can have it exactly as it is. Okay, but what if you don't like Medicare? Once again, the no people. Okay? Well, basically, here's how Paul Ryan's plan works. And for these no people that are under 55, here's the advantage to you. Basically, the government is going to go out and they're going to set up what they consider to be a standard medical plan. This standard medical plan, it's going to include basic checkups, basic visits to the doctor, all these basic medical procedures that we all should be doing every year, and they're going to go out and they're going to solicit bids for this basic plan. Now, the bids are going to be for a quantity and a quality of care for a United States citizen, a standard United States citizen. Okay? Now, there's going to be all these companies out there that enter this bidding process. Some are going to bid high, some are going to bid low. It's to their advantage to bid low in this case. Okay? As normally bidding processes go low, you know, depending on which side of the bidding process, but basically what's happening is you'll have perhaps company A that bids for this standard plan, that they will provide it for, I'm going to make up a number, $4,000. $4,000. Company B will provide it for $5,000. Company C will provide it for $6,000. Company D will provide it for $7,000. Okay? Now once again, I've just, these numbers are made up, okay? But they're representative, okay? So we've got all these bids in, and there will be more bids down through here, obviously, but we've got these representative bids in that represent how the system's going to work. The government will come in and it'll say, okay, we got all these bids. $5,000 is going to be our baseline, what we will pay for the level of coverage that we've specified. Once again, that level of coverage has a quantity and a quality level to it. So the $4,000 bid right there, that's on the same quality and quantity. Company A has to provide it for $4,000. Company B said they would provide it for 5, C would do it for 6, and D for 7. Okay. Government's established $5,000 as the baseline one because it's the second lowest bidder. Now they'll do this every year. Each year they'll come back, they'll redo this, and these numbers may change, you know. I mean, obviously it's not going to be $5,000 to be, you know, when it comes to, you know, it'll be $5,122. $5,000 baseline. And that's what the government's going to send you a voucher for. They're going to send you a voucher for $5,000. And if you go out and you contract with Company A, then during that year, you'll spend about $4,000 with Company A to get your standardized health care. Okay? So, at the end of the year, government gave you a $5,000 voucher. You only spent $4,000. Guess what? You get to put $1,000 in your pocket. You get to keep it. You get to do whatever you want to with it. You don't have to spend it on medical care. You can go out and buy soda pop with it. Not telling you to do that, but you could. What about the person that goes with Company B? Well, they spent $5,000 and they got $5,000 from the government. Well, their net benefit, in this case, well, not net benefit, but the net to them is $0. They don't get to put anything in their pocket. Okay? What about the person that goes out and spends with Company D for $7,000? Then they are going to have to pay out of their pocket $2,000. Okay? Now, I'll cover this in a minute. Okay? They probably won't pay $2,000, but I'll cover it in a moment. Okay? What this does, what this system does, is it makes it an incentive for all the people in the United States, all the citizens, all the adults, to go out and find the least expensive health care for their needs. Rather than the government trying to, you know, whittle it down, whittle it down, whittle it down, what we're doing is we are relying upon the citizenry to go out with all their eyes, you know, looking at all the various plans and saying, gosh, I can get this for $4,000. The same quantity and quality for $4,000. I can get it. And I can put that in my pocket. That's a huge advantage to the citizen. Huge. Because they're getting the same quality and quantity as the person that's contracting with B. Or the person that's contracting with C and D. But that citizen's putting $1,000 in that citizen's pocket. Now, not only is this helping the citizenry, it's helping the government save money in the long run. So we all wind up with lower taxes. Lower taxes are a good thing for everybody. Okay? Because, like I said at the beginning of this explanation, it's to the advantage of these companies to come in with a lower bid when they're doing the bidding process, and it's to their advantage to make their price on a day-to-day basis a smaller amount, because they're going to get people that want to put this $1,000 in their pocket. There's going to be a lot of people out there that want to do this. A lot of people that are going to be striving to put that extra dollar in their pocket. Okay, so what happens if you're the guy that needs a hip replacement. Look, $5,000, it's not gonna do it. You're gonna need a lot more money. I just had a friend who had a hip replacement surgery done. Within the last year, she told me the total cost of that hip replacement surgery was $65,000. $65,000. That's a lot more than $5,000. Okay? You're like, oh my gosh, what am I going to do? Okay. That's where the free market comes into play. You're going to have to go out and contract with private insurance for catastrophic insurance coverage. Okay? So, the catastrophic probably, well, the catastrophic is obviously going to cover the $65,000 for the hip replacement. And, if you get the right company, they're probably going to pay for this too. Okay, this $2,000. If if it's company D that you're contracting with, they're gonna pony up for that $2,000 right there. Okay, so that's basically how Paul Ryan's plan works. It puts a lot of people in the United States, all of those, like I said, all of those eyes out there looking for a good deal for themselves so they can put that $1,000 in their pocket, which drives these costs downwards. Everybody's striving for the same goal. Keep everything down. We're not putting big money into the corporate fat cats' wallets or into the doctors' wallets, okay? Because once again, they're striving to keep it low in order to keep their customers. So this has huge advantages for the United States. And I hope that you like the plan. I like the plan. As a 50-year-old person, I think it's fantastic because it gives me choice. It gives me a quality and quantity, once again, of healthcare coverage and a choice. Currently, my mother is on Medicare, and my mother has been denied a prescription drug. She's been told, no, you can't have it. Well, that's not the case with Paul Ryan's plan. But the current way Medicare works is they can deny you coverage. They can basically say, no, you can't have that drug. I've seen it. I've seen my mother denied a prescription drug today. So this, to me, it's wonderful because I can go out and if I need that drug is the one that works for me personally. I can get it. I've got choice. I've got freedom of choice. And I've got an incentive to save some bucks in order to put a few bucks in my pocket. Okay? Anyway, that's how Paul Ryan's plan works. I hope you enjoyed my explanation. I enjoyed bringing it to you today. And have a good day.